A set of unique robotic arms may one day help stroke victims retrain their brain to move their limbs.
I did have a stroke, whatever it is, 12 years ago. After the stroke, it had affected my strength, my right arm, my right leg.
In the biomagnetic imaging lab at UC San Francisco, Fred is helping scientists test the robotic exoskeleton arms. Small sensors in the robotic arms monitor Fred's movements and communicate them to a virtual world that he watches on a screen. The robot guides and supports Fred's stroke-affected arm based on the position of his healthy arm. A physical therapist offers advice and support as Fred completes several virtual reality games. The therapeutic robot system was built by computer engineer Jacob Rosen and his team on the UC Santa Cruz campus, about 80 miles south of the San Francisco testing location.
The exoskeleton that we developed has 7 degrees of freedom with 3 joints, meaning that it can support any movement of the human arm.
This means that the arms can reach 95% of the typical human range of motion.
Other systems don't provide this much of flexibility in moving and supporting all the joints. Furthermore, we have 2 arms. And what is unique to the treatment that we are studying is dual arm treatment, meaning that the patient is wearing these 2 arms and they're using the healthy arm to drive the disabled arm, which is quite unique to our system, and it's very beneficial for the recovery as well.
So the unaffected arm clearly helps you as part of the process. I could certainly tell that testing. So there were a couple of things going on here, not just a robot, which would help you, I think intuitively would help you in the process. But the fact that you're also doing things bilaterally, I think that was probably the big thing here.
Bilateral or two-sided therapy, like that being tested at UC San Francisco, may make the best use of the brain's ability to adapt to trauma like stroke. In stroke, an interruption in blood flow damages a part of the brain, leading to reduced motor control on one side of the body. While the damaged area of brain can't be regrown, the brain can work around the problem and make new neural connections. Researchers hope that symmetrical exoskeleton robot will help patients make the most of this rewiring capability.
It's a serious test of your range of motion, and it was hard work. And I would be sweating every time I went through that process, so it wasn't easy. I think you have to go through those stressful things in order to rewire your brain. I don't think it occurs just normally. I think in order to do it, you got to work hard at it.
So moving the exoskeleton from a lab to a clinical setting is a very rewarding exercise for us. But it's also very challenging because a research lab is a very protective and well-controlled environment, where the clinical setting is exposing it to higher stress.
Looking at the robot, this metallic, this Iron Man sort of a thing, right? Sitting in a chair and putting these exoskeleton arms on, it's not frightening, but it's a little bit alien, right? And I think anytime you do something like that new, it's a bit of a challenge.
It is very rewarding, not just technically but emotionally, because you work for a decade developing a technology, and eventually you see that this technology can affect someone's life.
As the study progresses, Rosen envisions the robotic arms in a gym-like setting, perhaps in a physical therapy clinic, where multiple sets of the therapeutic systems could be available. Patients could go to train their brain as often as they like.
A drawback of other types of therapy, if you're doing it on your own, it can be drudge work, right? I think people give up in part because of that. It's a pain in the neck, so they give up. And so if you can play a game and be at least somewhat entertained, right? I think it makes a big difference.